afternoon. Welcome. I'm Erin Kelly Seal. I'm the director of the Department of Human Services, and it is absolutely exhilarating to see all of you here today. I thank you so much for being here. I just want to acknowledge at the outset that I won't be able to acknowledge everyone who is here who is critically important to children and families in this state. It's remarkable to be able to say that we have people from counties as far away as Josephine and Tillamook and Eastern Oregon, Pendleton. We have leadership from every branch in the room. Of course, the governor's here. Extremely thankful to the governor. We have Senator Steiner Hayward here representing the legislative branch, Judge Nan Waller, and Judge Prawl and Judge Crane representing the judicial branch. I was just checking to make sure did I miss any judges or elected officials? And so many community partners, district attorneys. It's just really inspiring. As someone who's worked on kids issues for a while, it's not often that the child advocacy community comes together around an agenda and says, this matters, this is important, and we all want to work together for it. So I just want to thank you for that. I could go on and on and on with names. There are tribal partners here as well. I don't want to miss recognizing our government-to-government partners in the work. And many others, and I apologize if I'm not recognizing people that I should, but I want to just make a few brief remarks and then turn it over to the person you really came here to hear today, which is Governor Kitzhaber. I just want to say that as the state child agency devoted to protecting kids, those of us at the Department of Human Services are rightfully so held to a very high standard. When things go wrong, we often share our failures and our heartache with the public, and it's too rare that we share our successes and our celebrations when things go right. That's one of the reasons that today's event is so important and so meaningful, and I just want to acknowledge another group of very important people who are here today, and those people work for the Department of Human Services and Child Protective Services in particular, and I just want to give them a hand for the work that they do. But today is really about the results that we've collectively achieved together over the last 5 years on behalf of Oregon's children and families, and really more importantly, to commit to a brighter, stronger future and a continued transformation. Since 2008, with close monitoring of data and information that watches out for the safety of children who've been abused and neglected, our collective efforts have resulted in fewer children in Oregon experiencing foster care and more kids being served at home or with family. Remarkably, those achievements have happened at a time of economic recession and with system-wide resource challenges. Even more notably, those achievements wouldn't have happened without the collaborative effort that we've built together. A collaborative effort that by design leverages public and private resources, implements research-based practices, and empowers local leadership to ensure that all Oregon children thrive. I want to personally express my sincere appreciation to every person in this room for engaging with the child welfare system at a deeper level, standing by us through thick and thin, and committing your time, talent, and passion to strengthening the broader child protection system in Oregon. We have not come as far as we have, nor can we further advance our goals on our own. What has fondly in Oregon become known as the KC Partnership has proven that, and I want to recognize our very special guests here from KC Family Programs, one of whom you'll hear from a little bit later, but David Sanders is here, and Tracy Savoy. Where's Tracy? From KC, and I just want to recognize and thank you both. I just want to give you a practical example of what we mean in a real life story that happened in one of our KC counties and is really symbolic of and evidence of the partnership and how we work together. There was a mother who was married to a violent partner who was having trouble protecting her children, and child welfare got a phone call. We became involved, and the mom decided that she would leave and go to safe housing with her children so that they could stay together, and our system, the government system, actively was working to keep her together with her children in a hotel room. Over the course of a couple of days, we realized that we weren't going to be able to continue to afford financially the support for this mom and her children in this hotel. And all of our efforts to reach out to other government housing programs were not fruitful. So one of our local managers who had gotten to know someone in the community through the Casey partnership reached out, called upon a local pastor, and explained the situation. And the pastor said, you know what, I think our church would gladly continue to support this person in one of our parishioners' homes. So they did so, financially supporting her. She now is in housing with her children, did not have to be separated from them, and was able to keep them safe on her own in that protective way with that partnership between us and the community. And I know that countless stories like that exist in the hearts of every person in this room. Stories of parents in recovery, stories of youth successfully transitioning to adulthood, stories of children reintroduced or maintained in their family culture, stories of families found and families made. Stories that help us answer the question, how are the children, with an answer that says, this child or those children are safe and are well. So how do I know those stories aren't unique and that more and more are becoming commonplace in Oregon? Well, I want to point out a couple of statewide statistics that I think point to our successes in the work. After consistently ranking in the top quartile of states for removal of children into foster care, in 2011, the number of children entering foster care in Oregon was the lowest in the past 5 years, a 7% decrease from 2010. In 2011, 67% of child victims of abuse and neglect remained safely at home, and the percent of children and families receiving in-home services increased. For those children who did enter foster care, we've increased placements with relatives by almost 55% over 5 years. Our work with culturally specific providers is beginning to pay off in terms of reducing disparities and increasing family stability and child safety for children of color. We've seen an increase in the percentage of children leaving foster care to be reunited with their families, and notably 13 Oregon counties decreased their foster care placement rate in 2011, and 17 Oregon counties reduced their overall foster care population that same year. Today, compared to where we were 5 years ago, Oregon's child welfare system and our community-wide efforts on behalf of children are clearly on the right track. We've come a long way, and we should celebrate that because we did it together. But at the same time, we have to acknowledge that in spite of our efforts, too many children are still being hurt, and too many families are still being left behind. Which brings us to our second reason for being here today, to join together in support of the governor's recommended 2013-15 budget investments in children and families and in the child welfare system in particular. The governor's budget invests in two critical components of child welfare system transformation. First, it calls for the implementation of a differential response model of child welfare intervention, a model that will transform the front end of our child welfare system, allowing more children to remain safely at home and more families to be more connected in their communities. And second, it includes investment in community-based programs and services, fully implementing legislation that passed in 2011, the strengthening, preserving, and reunifying families legislation. And Rita, for coming up with that name, I'm going to have to make you come up here and say it one of these days.
I would deserve it.
The governor's budget builds on all we have accomplished together to date and reinforces what we have learned to be true, that safety and security for our children and families depends on all of us, and no single entity, governmental or non-governmental, can get those results on its own. Together with his budgets in education and healthcare, this governor's budget begins to shift the focus of taxpayer investment in children and families away from a crisis response to family instability and toward high-impact, proven practices that will prevent further costs, both emotional and financial, down the road. So with that, I think it's time for me to turn this microphone over to my boss and your governor, John Kitzhaber.
Well, thank you very much, Erin. And Erin covered, I think, actually most of the high points that we need to discuss today. I just want thank you for the opportunity to talk just a little bit about the tremendous improvements we've made in our system of child welfare, and also go into a little bit more detail on the budget that we put together that I think supports and will ensure that that progress continues. I think it's fair to say that there are always going to be tragedies in our child welfare system. And I think one of the things that irks me the most is that the only thing that gets covered are the tragedies. I remember practicing emergency medicine where we were required to report any suspicion of child abuse, and it was often difficult, particularly in a small town like Roseburg, because you knew most of the people. And I remember one of my professors in Denver when I was in internship said that no parent or family ever died of embarrassment. But the fact of the matter is, what makes the headlines are the kids who we don't get to in time. And what never makes the headlines are the hundreds and hundreds of children who we save and who this system preserves and puts on a real steady track. I think one of the things that Erin has done in her leadership at DHS is to recognize that our child welfare system, our foster care system, is not a benign system, notwithstanding the tremendous number of good-hearted, wonderful citizens who take these children into their homes. The fact is that the children who do the best are the children who never have to actually leave their homes. And so what Erin and her team have done is really created a policy and a program and an opportunity around the premise that we need to keep those kids and those families reunited. This is a core priority of my administration. It speaks to the very premises behind the budget, which is to spend on the front end, not spend on the back end if we can help it, and to try to align the efforts in this space with the reform efforts we're trying to make in education and in healthcare. And clearly the success of the work relies on communities throughout the state of Oregon. It relies really on anybody who champions the cause of children and youth and families. And some remarkable partnerships have developed through this process. Certainly the Casey Family Programs that we're going to hear from later, really instrumental, tremendous leadership for the state. Key legislators, Senator Hayward is here. I know Speaker Kotek has been very engaged and supportive of this effort. Our judicial department, we've got a number of judges here. Judge Waller was on my transition team on early childhood. The Youth Development Council, certainly the Department of Human Resources, and some remarkable businesses and organizations. Erin, I think, spoke already to the statistics, the remarkable statistics about how we're really turning the dial on the number of kids who end up in foster care as opposed to being with their families. I do have to just take this opportunity and thank again the leadership of Erin in DHS and Lois Day. Without their support, without their belief and time and energy, we wouldn't be where we are today. So thank you very, very much. Let me say just a little bit about differential response. I think Oregonians are usually surprised to learn that chronic neglect of children is one of Oregon and probably the nation's most embedded problems for creating risk for child welfare. And there are some pretty clear metrics around chronic child neglect, extreme poverty, domestic violence, substance abuse, mental health issues involving the child and or the parents. And differential response, just to put it in a nutshell, is fundamentally redesigning our initial response system to recognize that not every family needs investigative intervention to address child safety issues, and that we can, in fact, provide support to prevent the unnecessary removal of children from families and to reunify those families when it's appropriate. And by supplying families with these services that are designed to help them with their parenting skills and to keep that child safe at home, we can reduce a tremendous number of unnecessary and often actually harmful foster care placements. So that's why I've put in my budget $23.6 million to implement the differential response system in the state of Oregon. And we expect that investment to result in a 15% reduction in foster care placements in Oregon over the next decade. Certainly our traditional CPS response will continue for children who are at high risk, where we need more state supervision and involvement. But we have this other alternative, and I think it's going to bear tremendous fruit. As Erin said, we've also fully funded these community-based investments that were started last year by the legislature, and see if I can say it, strengthening, preserving, and reunifying families programs. God bless you for that acronym there. Essentially, what those are is essentially it refocuses services to ensure safety while also focusing on child well-being and family stability, which are two real key elements to keep these kids at home. and to avoid placement where possible by supporting parents and helping them with their parenting skills so they can keep those kids safe and at home. So I'm very committed to partnering between and collaboration between state efforts and efforts out there in the community across the state of Oregon. I think it's very important that we try to align those efforts, whether they're state or local, with the work we're doing with the coordinated care organizations and with the Early Learning Council. This is a big change. And big change often meets with big resistance because no one knows quite where the path leads. But the fact is, what we have been doing isn't working as well as what we're trying to do. We've got evidence of that already, and I think that with appropriate investments, with successful delivery systems, and with clear accountability for defined outcomes, we can get a huge return on investment here in terms of healthy, productive citizens and in terms of the reduced cost of social services that we can once again invest on the front end. So there's really good work being done here, and we should celebrate it. And I just really appreciate the opportunity to come down here and thank you for the work that you're doing, and to encourage you to continue leading into this one, because we've got some momentum, and I think there are no limits to where we can go. Thank you very much.
So we've mentioned a couple times the catalytic involvement of KC family programs, and I also want to mention that there were some pioneers of that conversation with KC. Mickey Lansing is here, Brian Johnston, who is no longer with us. Without them and their commitment to this conversation and to reaching out to KC and their initiative, I don't think we'd be here today. So I want to take, it's my great honor to introduce David Sanders. David is the Executive Vice President of Systems Improvement at KC. He's been part of Oregon's Safe and Equitable Reduction effort from the beginning. He joined KC Family Programs in July of 2006. He oversees the foundation's work with child welfare systems to improve practice, with an emphasis on ensuring safe and permanent families for children. He also oversees the foundation's public policy work. So please thank David and Tracy for being here today.
Good afternoon, and thank you for the wonderful invitation and for the opportunity to have this conversation about the work in Oregon. I'm absolutely delighted to be here on behalf of KC Family Programs. KC is the nation's largest foundation focused exclusively on improving results for children in the foster care system. In 2005, there were 511,000 children in foster care nationwide. Today, that number has fallen to about 390,000. We expect that it'll be even lower this year. That's 120,000 more children who will be going to sleep tonight in their own homes and with their own families. And Oregon, which has seen its own safe and significant reduction in foster care since 2005, has contributed to that very positive result. The safe reduction in the number of children in foster care didn't happen by accident. It's a result of hard work by a growing number of states and county agencies that are focused on prevention, permanency, and taking innovative approaches to improve results of our country's youth. Oregon's strong statewide collaborative is a great example of this. The governor's announcement today and the work we've been engaged in the state clearly shows that Oregon is putting children and families first. Improvement begins with strong leadership, clear vision, and a commitment to improve how we serve vulnerable children and families. Governor, you and Erin Kelly Seal exemplify those important qualities, and I want to personally thank you for your leadership and the wonderful work being done here. Change also requires all three branches of government, executive, legislative, and judicial, to work together to improve the child welfare system. Progress is often too short-lived without the kind of cooperation and shared vision that the courts, the legislature, and the governor's office have shown here in Oregon. And I think you've heard that multiple times through the acknowledgments in the audience. And the third ingredient to ensuring an even brighter future for every child in Oregon is effectively engaging the entire community, including tribes, businesses, schools, faith communities, nonprofits, and families. In doing so, the courts and government in Oregon are truly putting children first. At the end of the day, we all have a responsibility to make a difference. Having personally seen the difference that implementing differential response has made through the work that I've been fortunate enough to do in both Minnesota and in Los Angeles, I can tell you that Oregon is on the right track. When we worked to implement differential response when I was in Minnesota, there were doubters that this approach could work. I think the governor laid out why this approach works, though, and today we can say with confidence from the research that the approach is effective. By working with more families at the first sign of trouble, we can keep more children safe from abuse and neglect and help to strengthen at-risk families. I'm proud of the partnership that has been forged between Oregon and Casey Family Programs. It's inspiring for us as a foundation to support the kind of forward-thinking work that's taking place in many of the counties across this state. In our 2012 annual report, Casey Family Programs highlighted how a broad group of community members in Salem, including business leaders, law enforcement, nonprofits, and others, came together in support of the child welfare system to improve the lives of children and families in need. We see another example of that kind of community-based thinking in Multnomah County, where faith leaders are working hand-in-hand with child welfare officials to help struggling families before abuse and neglect take place. By coming together as a community and using approaches like differential response to address the diverse needs of children and families, Oregon is making a difference in the lives of its most vulnerable population. I want to thank all of you for the great work that you're doing with youth, young adults, and families in Oregon, and the example you're setting for other states across the country. Thank you.
Members of the media here, if there are questions, I think
all the substantive questions will be referred to.
I'm wondering if somebody could give an example of how something would be handled differently under this differential response model than how it would have been.
Sure, thank you for that question. So today we have a model that is based on originally the law enforcement construct, where a call gets made and the job of Child Protective Services is to determine whether or not fault should be found. Did abuse happen? Does the person then permanently have a finding of fault on their record around abuse or neglect? The idea with differential response with certain types of families, and it won't work for all families, but with certain types of families after a very intentional screening process, is to allow for a different path. That's the name, different kind of response for those families that would participate with the families in the challenges that they're experiencing in a different way, both by the child welfare system as well as by the community, and if at all possible, encourage resolution to those challenges without ever having to go through that fault-finding path. So there is an expert in the room, our differential response manager, Stacy Lake, and she might also want to come up or say a few words about sort of the vision if I've missed something or mischaracterized anything. But I think that's the primary difference. I'm horrifying her at the moment.
She said, no matter what you say, it's good.
The primary difference is just to create an opportunity for families to resolve their challenges, recognize the government isn't the only one that can help them with that, engage the community differently and earlier, and avoid that trajectories sometimes that can occur with families where our relationship with them becomes very adversarial. So the idea here is to partner with families to resolve issues like neglect, domestic violence, substance abuse, which are really the leading causes of abuse and neglect in the state.
If there's more efforts to solve the problem from the front end, I noticed just in this report there's been an increase in the number of abuse and neglect reported. What sort of accounts for that increase within this graph?
So I think what you're referring to is that the number of reports of abuse and neglect. So it is very true that the reports of abuse and neglect in Oregon have been going up consistently every year, and we actually think that's a good thing. When someone has a concern about a child or a family, we hope that they will call and give us an opportunity to use the criteria in the law to establish whether or not a child is at risk of immediate harm and whether abuse or neglect potentially is occurring and warrants an investigation. So I think there's been a lot of effort to really promote the idea that people should reach out to Child Protective Services if they have a concern. It's also true that the number of child victims of abuse and neglect has gone up, and I think that's attributable to many, many factors. Some of it is really, in many ways, driven by the economy, and when you look at what the primary drivers of abuse and neglect in the state are, issues like substance abuse, domestic violence, and neglect, threat of harm, I think that probably can explain some of the increase, at least. Also, that increased awareness, which we think is a really good thing.
Children First for Oregon and the Oregon Foster Parent Association have both said that they're frustrated with DHS because your caseworkers are often young, inexperienced, and ill-trained. Will this address that?
You know, I think there are investments in the governor's budget that are not just about differential response, but really about holistically investing in the system and the capacity of our staff to respond. I don't think it's a secret, but we've been at about a 67% staffing level in child welfare for the last 2 years. That means we have 33% fewer staff than we need to meet the legal criteria that are set in state and federal law. And we certainly, as the budget has declined, have had to make some adjustments to our investment in training and other resources for our caseworkers. So we're very much looking forward to the opportunity to reinvest in our workforce and to establish the expertise that we know is there and really that this line of work demands.
Yeah, I just want to add something. You know, I appreciate the criticisms out there. I also think it's sort of a broad generalization because there's a lot of really experienced, well-trained people in the child welfare system. This is another one of those cases where we go right to what's wrong and sort of ignore what's right. And I think people need to understand in this day where it seems to be in vogue to whack people who work for the state. I mean, these are people who are extraordinarily overburdened. There's no question that when the economy goes down, the stress on families goes up. I was working in the ER in Roseburg in 1982 when the bottom dropped out of the economy, and these proud families, hardworking families who could no longer put bread on the table, and you saw it in the disintegration of families and pressure. So that's going on at a time when we've underfunded DHS and ask extraordinary things of these people. So appreciate your question. I just want to make sure that we understand that the Child Protective Services is populated by committed people who are working under extraordinarily difficult circumstances, and the investments that we're trying to make in DHS in those workers need to stay in the budget because it's going to provide better training to address the issue you raised, but also do, most importantly, provide a better service for the kids in this state who benefit from it.
Should you be using the $23 million to beef up your staff?
Well, some of it is going to beef up the staff. It's hiring more workers, but it's also investing in training as well. But again, I'm just going to push back and say there's a lot of that staff that doesn't need retraining, that are doing a really good job day in and day out. And part of the reduction, part of the 5-year low in the kids who are being placed in foster care is because we've got really effective workers in there who are doing their job and moving the dial.
What do you think about the Foster Kids Bill of Rights that's proposed? Give them more say in what happens.
I'm not aware of that. Pass that to.
You know, we've been partnering with the Oregon Foster Youth Connection on the proposals that they came up with last fall and how to implement those and what the right way to do that would be. We're actually just getting up off the ground an independent foster youth advisory council to the agency right now. So we've enjoyed a really strong partnership, I think, with foster youth. We're extremely excited about their leadership in the conversation. And specifically to the Bill of Rights, we think it really merits conversation and discussion, and something I think we all want to be supportive of.
Do you think DHS should be more transparent in how decisions are made?
I think DHS has gotten increasingly transparent in the last several years about how decisions are made. We're one of the few states in the country that actually publishes reports when something goes wrong and outlines exactly what happened in those cases. We're launching new data sets. We publish annual reports with our data in it all the time. I think we've been very transparent in how decisions are made, and anytime questions get asked, we are more than willing to answer them within the parameters of the law. Of course, we have constraints. When there are active cases and children's privacy needs to be protective, I know it's very frustrating for the media and for the public, and it's hard for us as well, because sometimes we have a story to tell that we can't in the interest of protecting the privacy of the children and families that we're serving.
I was just in a case where a judge in Multnomah County was very frustrated with DHS for not being transparent.
Well, that is one of those open cases that we would be happy to, talk more with you about within the constraints that we have. And we certainly understand that we're not perfect all the time. We make mistakes. It's a human system comprised of human beings serving other human beings, and things happen. And when they do, we also believe in holding ourselves accountable for that. So I think that that's one of those situations where we're a little limited in our ability to comment because it is an open case.
I have a question, actually. What kind of sort of families would qualify for differential response, and which ones would be disqualified?
I'm wondering if I could have you spend a little bit of time with Stacy, because I think Stacy could spend some time talking about the proposal that we're thinking of around the assessment tool and how that would work. I think just like most things, every family that comes into our system is very individual and unique, and so there aren't categories specifically that I think we're trying to group people into, but we definitely have some parameters in thinking. We'd be happy to share those with you.
Thank you, everybody. Thank you very much.
Great, thank you.